Hello everybody, in this video we are gonna talk about the posterior pituitary gland from the chapter 15 endocrine pathology from the book Fundamentals of the Pathology. Before watching the video, please like and subscribe my YouTube channel. First of all, we will discuss two main hormones of the posterior pituitary gland. The first hormone is the ADH or the antidiuretic hormone, and the second hormone which we are going to talk about in this video is the oxytocin. So let us discuss these two hormones of the posterior pituitary gland. The first hormone, the ADH or the antidiuretic hormone, acts on the kidney, on the distal tubules as well as the collecting ducts, and it promotes the retention of the free water. Whereas on the other hand, the oxytocin, it performs two functions. Number one, the suckling action, or we can say the releasing the breast milk in lactating mothers, and number two, it performs the contraction of the uterine during labor. Remember that ADH hormone and the oxytocin hormone, they are produced in the hypothalamus of the brain, and they are later on released in the posterior pituitary gland. How? Through axons from the hypothalamus. Now we are gonna discuss about two main types of the diabetes insipidus. The first type is the central, which is due to some sort of brain problem, and the second type is the nephrogenic type. The nephrogenic type is due to kidney problem. So whenever we hear the word diabetes, it refers to the fact that the person is doing a lot of urination. So there are two main causes of the central diabetes insipidus. The first main type is the ADH deficiency, and the second cause is the problems with the posterior pituitary or the hypothalamus of the brain. It could be some sort of infection, it could be some sort of tumor, etc. etc. Now we will discuss the clinical features of the diabetes insipidus. The clinical features are based on the loss of the free water due to excessive urination. So the first clinical feature includes the polyuria and the polydipsia. It means that a person is drinking a lot of water, or he may be at the risk of dehydration. Dehydration means loss of water. The second clinical feature includes the hyponatremia, in which their sodium concentration increases in the blood and the serum is concentrated, so there would be high serum osmolality. Since the person is urinating a lot, so he has low urine osmolality as well as he has low urine specific gravity. Now moving on to the diagnosis as well as the treatment of the central diabetes insipidus. For the diagnosis, we use a special test known as the water deprivation test. For example, if a person is forced not to drink water, he can't concentrate the urine. This person won't be able to concentrate his urine. Why? Due to excessive ADH hormone. For the treatment, we use a drug known as desmopressin. This drug is ADH analog. Now we will discuss the second type of the diabetes insipidus, which is the nephrogenic diabetes insipidus. It is due to the kidney problem. Now we will discuss two main causes. The first cause is the impaired renal response to the ADH. It means that the kidneys won't be able to show response to the ADH hormone. The second cause includes the inherited mutations as well as the drugs, for example, lithium or demiclocycline. Now we will discuss the clinical features of the nephrogenic diabetes insipidus. The clinical features are similar to the central diabetes insipidus, and the treatment includes no response to the desmopressin. In nephrogenic diabetes insipidus, the kidneys show no response to the desmopressin. Now we will discuss SIAD or SIADH. Its full form is symptom of inappropriate ADH secretion. There are three main causes for that. The first main reason is the excessive ADH secretion. The second reason is the ectopic productions. One of the classic example of ectopic production is the small cell carcinoma of the lung. Here is the lung, and the carcinoma of the lung could cause SIADH. The other causes include the central nervous system trauma, pulmonary infection, or the drugs such as cyclophosphamide. For the SIAD, the clinical features include hyponatremia, which means accumulation of the sodium or the concentration of sodium in the blood. The serum osmolality would be very low due to excessive urination. It also includes the mental seizures that could lead to the neuronal swelling as well as the cerebral edema. For the treatment, we use a demiclocycline as well as the free water retention. Thank you for watching the video. Please like and subscribe my YouTube channel.